Welcome again to The Silent Struggle. I'm here joined by my co-host, David Magnusson, retired police chief. How are you, sir?
Doing well. How about yourself?
Oh, man, we're doing well. We haven't spoken in a while, right? We just did a show a few minutes ago.
It's a good topic, though.
Yeah. And we have an honor of introducing someone who I look at you as one of the silent heroes in the county dealing with mental health. It's Luciana Beltran of I'm stopping to pause because I wanted to make sure I get the name of the unit correctly. The Mobile Response Team.
Yes.
We're going to get into it as to what you do. But before we say anything, I want to thank you beforehand because I know that you are responsible helping countless individuals in the county who are struggling. So let's get right into it and give us an idea of what the Mobile Response Team does.
Okay. Alrighty. Well, thank you for having me here. It's also a pleasure. Thank you as well. So what does the Mobile Response do? We are clinicians with different titles, you name it. I guess that degree is the last thing of the concern, but we all are licensed clinicians doing assessments in the field. So the way MRT operates, we have a 1-800 number. It's 1-800-HELP-YOU, where anyone can place a call. Anyone can call for themselves. You can call for a family member. You can call for whoever. We have dispatchers that have a master level of education, so they will do a pre-screening over the phone. But the goal of MRT is to go out and assess anyone, whatever they are. Like even if the person is, under a bridge, whatever they are, we go and we assess. That's my goal as the director of the program, and that's the goal that I'm kind of putting out there for the clinicians. So once the call is placed, we have right now 3 locations, soon to have 4. We deploy a team depending on when the call is coming, and then the way we respond, it's a clinician, a behavioral health technician, and sometimes we have a peer specialist coming with us, not always, but sometimes they are more than welcome to join us. We go and do the assessment. So how does the assessment look like? A little bit difficult to have an answer for that because every call is
let's look at examples.
Okay.
Okay. David, what do you think? We get into the meat of it. We talk about actual situations that have occurred and how you handle those, because what we want is the public to understand that they're not alone, right? Although we are backgrounded from police and military, we have our own issues within our community, as you know. We want to draw the connection between, the struggles that public servants have, but they're the same struggles that the community does.
Correct.
So you have incidents that you probably responded to that maybe you can share. What are your thoughts, David?
I think
how do we frame this thing out?
The phone number itself, help you. Putting this information out, obviously, names and places change perhaps.
1-800-HELP-YOU.
1-800-HELP-YOU. But hearing these stories are going to help people that are tuning in to listen. They're going to walk away from this with some more knowledge that they didn't half hour before. So I would be good to hear that.
Okay, absolutely. I have stories. I have plenty of them. I think I want to say that we do a regular morning during the week. We go a lot to the schools. And this is something very known, we respond a lot.
So adolescent care? Or?
You would be surprised. Elementary calls a lot, elementary, middle school, and high school. Those are our regular calls during the week. I want to say 3 calls per day, more or less. That's I want to say from Monday to Friday what we do the most. But we also have very diverse calls. I remember assessing one day someone who I didn't know who the person was, right? I get to their beautiful building in Miami Beach. Someone referred the person. I do my full assessment, and the person at the end tells me, well, just so you know, I'm a physician. I work in blah, 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 this hospital. The person didn't meet the criteria to go to the hospital, but I guess what I'm trying to say is that I'm just mentioning this case, anyone can be in a state of crisis and in need of an assessment, right? And that's how I describe the beauty of my job. And I always say it, and I'm so proud of what I do. We can go to Overtown and assess a family that have nothing, and we can go to Brickell, to a beautiful building with someone who's struggling with substance abuse, with mental health, and can get up of their bed.
Do you find that people that are struggling with mental health, that are the people that are, better yet, the people that are referred to you, right? The people that are referred to the hotline.
Right.
Do you find that many of them are in a state that they don't recognize what's going on with themselves, right?
Right.
That they're actually in crisis or they have a mental health issue?
I think, Robert, that for the most part they know. They just are struggling with the fact that I need help. You know, they're in that place where I've been here before. I know I have to go to the doctor, but I don't want to take my meds, but I don't want to be bigger, but I don't blah, blah, blah. So, and this is the way I present it, and the clinicians, right? We're here to have a conversation. And then if you have to go, it's like going to any doctor. That's what I tell everyone. If you have a headache, a stomach pain, you know, whatever is hurting, you go and you see a doctor, right? So we're trying to normalize talking to a mental health whatever, right?
And that's been basically the premise of our episodes here, is getting people to open up, to see you.
Right.
And I mean, they're placing the call. It's not family or friend or an employer.
Right.
They're placing it. So there's a certain bravery there, a certain courage.
Absolutely.
As we stated before, it's a strength. It's not a weakness. And certainly mental health issues do not discriminate. You talked about Overtown or Brickell. There's no discrimination there. What there is the courage of that person to come forward and say, you know what, this is what I need to do right now. Like you alluded to, broken arm or any other physical issue.
Right. Yeah, that's the conversation that we tried, even since the moment that we get a call and the dispatcher has that interaction with the person, right? They are terrified. They're asking a million things, but who's going to come? But do they have a uniform? Is there police going? It's like, this is just a human being, you know, that are going to show up and have a conversation with you.
I think you and I we can all sympathize on this one or understand the feelings that people get, you know, the embarrassment, right? You call, you don't want you don't want a scene outside your house, right?
Right.
You don't want the neighbors to say, hey, Joey or Susie is having a police or they're being dragged out of here in a straitjacket, right? So that sensitivity probably goes a long way in how you're treating people.
Right. We also show up in regular cars. No, we have the company cars, which is like a Honda, you know, an SUV, and then we have the MRT T-shirts, but it's just a T-shirt, and the BHT is also, you know, just a human being wearing regular clothes. So we tried. That's why, like I said, like we have to rely. If we have to rely on law enforcement, it is what it is, but we try our best not to, unless we find ourselves in a place, okay, maybe we need to start making calls, you know, for backup. I had a situation one day that I went on my own with a BHT, and then the person, they always tell you on the phone, don't bring the police, please don't bring the police. And they're trusting you, right? So you try to do what you can. So I show up, I do my assessment, but this person loses it. Like during the assessment, and I'm throwing my phone, he almost pushed me to the floor. Anyways, we had to call the police. And then he was very upset, but he needed to go and he needed the help. But we try to be very sensitive and very mindful of where the person is at.
Confidentiality, I'm sure, is a big thing.
An embarrassment factor too. They're battling to come forward with that strength we talked about, while at the same time they're battling the embarrassment factor of like, I don't want anybody, I want to do it. I don't want anybody else to know about it. Certainly I don't want a group in front of my house. Now everybody's going to ask questions or spread rumors. I get it. So you can see that there's already that conflict going on, even though they want the help and their concerns. So.
Yeah, I guess I would like to add on that. Not too long ago, we met with staff members from a hospital, and they were like more so like looking for information on how to help their employees. All of these employees are in the field, right? So what if we have an employee experiencing blah, blah, blah? And it's like, it's the same protocol. I mean, all the information is protected. The person can make the call, or you can place a call and let them know that someone is we can go to their house.
So your information is not going to be on blast, right?
No, no, it's not going to be. Of course, you go, you do your assessment, and then, nobody needs to know. Now, if there's an ambulance outside because we have to take you to the hospital, it could be a broken foot, you know?
Yeah, there's ways to explain that away. Yeah, but people are nosy.
But you have to educate people, right? Like we have to, but people don't know. And I feel that's why people don't look for the help, because there's lack of information or lack of awareness, and that's what we need to break.
So Luciana Beltran is the director of the mobile response team. You got it.
You're
trying to walk me through it.
Yeah, from WestCare the Village. They are the agency is WestCare the Village, and yes, I'm the director of the program.
And you respond countywide. You have an 800 number, which is 1-800-HELP-YOU.
Yes.
How appropriate. So, I was reading some stats. I was going through some stats in preparation for our series here that we're running on mental health and the silent struggle. And when you mentioned about adolescents, it hit me that the NIH, National Institute of Health, and the American, let me see if I get this right, American Psychiatric Association, or psychiatrists, the American Psychiatrists Association estimates that 43% of boys and girls under 18, equal 43% boys, 43% of girls, will experience at least one incident a year. Right? So this is reoccurring throughout the years.
Right.
That can lead them to PTSD. And I think a lot of parents don't realize that our children are experiencing the same stresses that we experience as adults. Can you talk a little bit about how what you're seeing amongst the adolescents, how they're being treated? Because I suspect that you respond for a child who's in crisis, the approach is a little bit different than an adult.
It's very different, especially when we respond in the schools, because as licensed clinicians, we don't need the consent of the parent necessarily. However, we encourage the school, to call the family. But
Of course.
regardless, yes, the assessment is different. What we normally see, it's like, I don't even like the term, but very broken families, a lot of no communication at home. Parents do not believe in mental health. You're not depressed, you're fine, get up. A lot of minimizing the symptoms. In some cases, I'm with a parent, is like, yeah, maybe you can do a little bit better than this. But for the most part, these people need help. I don't think, Robert, a person by choice is cutting their arms, And even if they're doing it to call attention, there's a reason why they're trying
An
to
underlying issue.
Right. There's some trauma that haven't been disclosed. There's some help that they're trying to seek and they're not getting at home, so they do it in the school. But I would say that the biggest limitation is engaging the family, because after we do what we do, they live with their parents, they live with their families. So where are they and how are they supporting, the aftermath of the storm, basically? And I mean, part of what we do is follow-ups, and we keep cases open until we're sure, the person is receiving services and stuff. But at the end of the day, they still go back home, right? So lots of trauma, lots of lack of support, I want to say, and that's difficult to work with.
Social media bullying, I'm
Oh
sure
my
that's a big
goodness.
thing now amongst the adolescents.
There's a lot of bullying in the schools. Social media, I don't think helps a lot, because they have access to everything and anything, and how people post put this back in your head, and you're gonna, count until 10, and let me see how you feel. So, and people do that, for whatever reason, but they do. So you have those, but then you also have the ones that they're just Googling a better way to kill themselves. It happens. It happens with 9-year-old, 10-year-old, 13, 15, 17. We see it every day.
Wow. So can you walk us through, you meet a person, right? A person in need. You evaluate them. You make a referral for treatment? Is that what happens?
Right. So we do the assessment, and two things can happen. If the person meets the criteria to go to the hospital, we try
What's the criteria?
Okay, so could be suicidal, homicidal, psychosis,
A threat to themselves or somebody else?
Right, but there's more than that, because
Okay.
some people have suicidal thoughts, and sometimes, you can have suicidal thoughts, that doesn't mean you're going to act on them. So we do our examination is a little bit more lengthy, and sometimes we have to talk and give people time, right? So people with diagnosis are not taking their medication. It's very complex. It depends on the case. Each case is different. If we think that the person needs to go to the hospital, we offer transportation services, which is through an ambulance service. We cannot put them in the car that we drive. We call the ambulance, and we take them to the most appropriate facility. If that's not the case, which is the goal, to de-escalate, to manage, and to engage the family, and to allow the person to stay in the environment, we refer for different services. And that's when the peer specialists come in, like with a referral for the community psychiatrist, therapy, groups, whatever is needed. And then that's when they start their work, the peer specialist.
And then is there, what happens after the referral is done to for care? Do you guys follow up?
For the most part, we do. I mean, on paper, we're supposed to follow up 3 times. That never happens. The peers that we have, and I'm saying this because they are truly amazing, they do way more than they're supposed to do. So sometimes they have cases open, like we can have a case open up to a month if needed, if the person needs medication. Sometimes they stay within WestCare, the village, seeing a psychiatrist of ours, so we keep them open. Honestly, and again, I'm not saying this because they are the peers of MRT, but the ones that we have are stars. Like if they have to go on a Saturday night,
Secret sauce.
They're amazing. I have to say it honestly, because they're doing way more than they have to do. They make sure that the person is fine. So then, yeah, I mean, to answer to your question, we do as much as we can. We try to leave the person with some sort of like resource, right? Therapy, whatever that is going to keep them on their toes. And then they have our number, so they can call us if they need us in the future.
Wow. What do you think, David?
It's one heck of a service. Now,
I'm blown away. I'm blown away.
How great is that? But I'm going to take a step back a little bit, because I didn't give it as much thought until you brought it up with the adolescents. It seems to me all the dominoes have to be in place. You're setting the first one, treatment's going on. But if the parents aren't open-minded, if they're, like you mentioned, that's it. Right. That's it. And it's going to get, I think, probably progressively worse. So alerting even the parents that are not in crisis, or hopefully they can see this and learn from what you're saying. Yeah. But open minds for parents is incredibly important if they're going to help their child, their adolescent, get back on track.
One piece that I could see as being a factor that prevents people for reaching out for care is this insurance crisis. First of all, we know that costs of living, our economic struggles across the board are pretty defined by many families, right? And pretty impressive on the family condition. So a lot of people, parents, for their children or themselves, or even singles, people in need, they won't reach out because they fear that they're not going to be able to pay for all this stuff. Right. And this service is provided to them for free, right?
Yeah, it is.
The taxpayers.
Yeah, it is for free. Absolutely. So that's.
So that means the ambulance that comes.
Yeah, they don't have to pay for anything.
The stabilization.
We put the person into the right. So we do the assessment of the ambulance. They are sent to the nearest facility, depending on where they go. I mean, some people tell you, like, I don't have insurance, like, don't send me to blah, 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 obviously, and you use your criteria. You send them to perhaps a different facility. But even the outpatient, if they stay with one of our psychiatrists, they will be able to receive the services. And we even facilitate the appointment with an iPad if needed, for the telehealth, for the ones that cannot go, or the ones that don't speak English, or blah, 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 blah.
That's an incredible help to the community.
It is. Let me ask you one question that's just been on my mind. It's going back to adolescence. Do you find, after the peak and the end of COVID, with the isolation of the children not being in school,
right,
have things flared up more so than prior to 2020?
I'm going to tell you this. Not at the beginning. There was a lot of fear from people. Obviously, there's the fear of bringing people to my house, fear of connecting, right? Which is, I think we all experience at some point, or in different capacities. But now it's starting to pick up again. What I've seen when it comes to symptoms and people, a lot of like identity issues, self-esteem, I'm not thin enough, I'm not whatever enough, and that's social media. You spend all these hours at home, doing school at home, and then watching blah, blah, blah at home. So of course you feel, and less connections. And we know that connections are the most important thing.
And it's culminating now, you see it now.
Yes. Yeah. Now, especially this year. I don't know why, but this year we're seeing a lot of that.
And I could think of a number of people or a number of cases that would have benefited from this. We talked about officers earlier, but it's not just officers, firefighters, teachers, frontline workers during this COVID period, post-COVID. Now we're post-COVID, but hopefully, right, we're so, I guess, coming down off that unknown crisis. Now we know we're better prepared. We should be better prepared, but nevertheless, it's still affecting people. Man, I can think of many people who would have benefited if they had known about this service, including those that have committed suicide.
Yeah.
Right.
And reflect on your career
Yeah.
and the amount of officers under your command who struggling, and the civilians, right? The civilians who struggled. So let's repeat the number for people, right? It's the
1-800
Yep.
help you. It's very
Help
easy.
you.
That's extremely easy to
1-800
remember.
help
Yes.
you.
Help
And again,
you.
it's 24/7. We also have a chat, like for the person that doesn't feel that they want to call, they might want to go through the website, it's WestCare the Village South, and it's gonna show up like a little box where they can.
Is that WestCareVillageSouth.com or .org?
Right.
Okay.
And then they will be able to see, it's going to pop up like a little window saying, hey, I'm here
Chat
to
window?
help you. So then they get to either place a referral for outpatient, or if they're in a state of crisis, they can have a conversation with the dispatchers, which is going to be live, like through a camera. That is less invasive than going to a house, right? So for that, I guess what I'm trying to say, for that person who is not ready to make a call and rather chat, they can use the website and just reach out through the chat. And they will have someone that they can talk to as well.
Again, this is a service for Miami-Dade County.
Everyone.
That's everyone.
Everyone.
Everyone. I'll make it clear. Everyone can benefit. Everyone who's in crisis can benefit.
All ages too, no limitations with the age. Like,
Senior care, I suspect, is big,
oh, we're
right?
getting so many calls for the elderly.
Especially as economic situations get harder, life expenses get greater.
Families need to work. They have their 83-year-old person at home with Alzheimer's or dementia, and they don't have the means to have paid to someone to take care of this human being. And it's like, I have to work, my husband too. What do I do with this person? Yeah, we are also, that's something that I've seen, I've had an increase on the calls for the elderly.
And anyone that's ever experienced a family member, loved one, neighbor, go through those bouts of the progression of dementia and related type conditions, it's heartbreaking. It sometimes like drives I don't want to make fun of this, but it's almost like it drives a sane to the verge of insanity, because you want to find help and you want to understand what they're going through, but you don't quite know how to communicate. And the patient or the loved one doesn't know how to communicate and tell you what they're feeling.
Or what they need, right? So that's also why the psychoeducation of what we do is so important. Not only us, but the peer specialists as well, and the dispatchers as well. Psychoeducation to the family, psychoeducation, what's going to happen after your kid comes back home, and what's going to happen after your family member is released from treatment or whatever, what's going to happen after. So psychoeducation, it's a key component, like with the elderly as well. The elderly, they don't know how to communicate. It's not that I want to be mean. It's not that I want to throw these objects to your face. It's just that my brain is not the brain that I had, 30 years ago. Families don't have that information. People don't have that information. For us, this is what I eat every day, right? But a regular human being have no idea. So we
Do you
need
guys get counseling yourselves?
Me personally, yes. I'm being completely honest. Yes, I call it my oil change. Absolutely necessary. I think we all should. Nobody understands that. You cannot talk about this with your friends. They will never get it.
I swear by counseling. I don't know if you've ever had it, but I swear by counseling. I think it's been so balancing for me.
Yeah.
It helps me realize that I'm human.
Yeah.
Maybe what I'm experiencing is normal to what the conditions of what environment I lived and worked in.
You certainly have to keep an open mind to it and know it's there for you. just like a medical doctor.
Right.
You know it's there. If you need it, you go. Don't have that strength. Again, it's a strength, not a weakness. And with components right here, with the program you're talking about, it's phenomenal.
And like we tell people, no, also if you don't feel comfortable with a clinician that you're working with, you can always change your clinician. Nobody's gonna get offended by that. But you're mentioning something that you mentioned that it's just keep coming to my mind. I just came back from a conference in Texas that was for first responders, wellness and first responders.
Yeah,
and
wellness is big.
Firefighters, police officers, couple of clinicians. So, and what I got from that conference was like, look for help. For first responders, like if you are seeing this every day, if this is just a number in your ear, another call, you need to talk to someone. So.
And it becomes hard. I mean, you can reflect on your career, and it's hard to ask for help.
It is, and
It
you see things that most people are never going to see.
Correct.
And you don't want to ever get to that point in law enforcement that you become so ice cold and stoic that it doesn't bother you. I mean, it's the normal thing is it's got to bother you. That's normal. It's got to bother you somewhere along the way. And year after year after year, you can see where this is going. I mean, first responders, military, and in Havelock, where I was chief over there, you had retired military because it was a Marine Corps air station. So you're doubling the trauma of what they've seen in combat and what they're seeing in police work. Something like this, knowing it's there, it's a safety valve. It's there. You just have to get people to say, okay, now I know where to go, and I'm going to do it.
Yeah.
So in the last 2 minutes, right, of the show, what message can you provide our audience on what services you're providing, but to meet their needs in this silent struggle?
The message that I would want, I guess, to give to everyone in the community is to reach out, like make the call. Even if you are not in a state of crisis, even if you're a family member, you just think they might need help, just make the call, ask for help. I think there's a misunderstanding when it comes to, again, I said it at the beginning, seeing a psychologist or a mental health counselor, then seeing a cardiologist or, someone who works with the liver. So this needs to be normalized. These conversations need to happen more often because we know what has been happening in the silence, right? And what happens when we don't talk, everything stays here in our thoughts, and that doesn't get any better. So speak up with someone, look for help. Just because you have a crisis team, and this is about MRT or not, just because you have someone showing up at your door, that doesn't mean you're going to be taken, by force or anything like that. We're there to help. We're there to listen. I always say it. I get paid to listen, basically. Yeah. And we love what we do. I mean, again, it sounds cliche, but that's the reality. That's my reality, and I'm blessed for having that. So for the community, reach out before it's late, before it progresses, before the symptoms cloud your mind even more. Call for yourself, call your family member, call for anyone that you think might need help. And we'll ask you some things on the phone. If it's appropriate for MRT, we'll do MRT. If it's not, we'll give you resources, we'll help you, we'll guide you, we'll do our best. We don't have all the answers. We don't have all the resources, but we'll try to give you something.
And then just to reiterate, their information will not be on blast. It's not going to be public record. It's not going to be on somebody's archive. They're going to, the government, right? The government's not going to know that you're needed help.
Right. It's treated like any condition, right? You go to the urgent care because, I don't know, you whatever happened in your feet, and then you get checked. They just give you your paper, your medical records. It's like, that's it. And all we do on our end, it's a progress note that it's for our own record. But this is not going to be known. And that's a fear that a lot of people have. Like, we have heard that before. I don't want my child to not be accepted in this university because of their... This has nothing to do with that. This is treated like any other condition.
Any parting words for our guest and the audience, David?
It's a stigma. You just touched. It's a stigma, and there shouldn't be a stigma. The strength comes in getting the help. What Judge Lightman said a little while ago, and it's good to keep in mind, is that the recovery rate for mental illness is far better than it would be for cardio or diabetes. So you get the help, you get back on track, and the longer you put it off, things will progressively get worse, without a doubt. But it's right here. What you need to do is right here. It's right. You've been told right now on this show, and made it simple how to call, what's going to happen, and you're one step closer to getting back to yourself. And you couldn't put a premium on that. That's just well done, and thank you.
So on that note, we have been speaking to the director of the mobile response team for Miami-Dade County. The hotline is 1-800-HELP-YOU. It is a service that's free of charge to anybody in need. Call them. They're here for you. This has been another show of The Silent Struggle. We want to thank the team at Miami's Community News, Julian, our producer, behind the scenes, making the show happen. Thank you.